Whether you're a healthcare professional or a patient, understanding HIPAA is essential in today's medical environment. First, what is HIPAA? HIPAA, or the Health Insurance Portability and Accountability Act, was passed in 1996 in the United States. Its primary goal is to protect patient privacy and the security of health information. HIPAA ensures that healthcare providers, health plans, and other entities handle sensitive patient data in a secure and confidential manner. HIPAA is made up of three key rules. The Privacy Rule, which sets national standards for the protection of health information. The Security Rule, which outlines how electronic health data must be protected. And the Breach Notification Rule, which requires organizations to notify patients in case their data has been compromised. So why is patient privacy important? Protecting patient privacy builds trust. When patients feel that their health information is confidential, they're more likely to seek care and share the information that can improve their treatment. Trust is fundamental in healthcare. By maintaining confidentiality, we create an environment where patients can share sensitive details without fear of their information being exposed or misused. Now let's take a closer look at what HIPAA protects. Protected health information, or PHI, refers to any health information that can identify a patient. This includes their name, medical record number, phone number, and even their health status or treatment plans. PHI can exist in many forms: paper records, electronic records, or even verbal communications. If it can identify a patient, it's protected by HIPAA. HIPAA also guarantees several important rights for patients. These include the right to access their medical records, the right to request corrections to any inaccurate information, and the right to request restrictions on how their information is shared. Patients also have the right to privacy. Healthcare providers cannot share their health information without their explicit consent unless required by law. So who must comply with HIPAA? HIPAA applies to covered entities, which include healthcare providers, health plans, and healthcare clearinghouses. But it doesn't stop there. Business associates, like IT vendors and billing companies who handle PHI, must also comply. Healthcare workers, whether they're doctors, nurses, or even volunteers, must also adhere to HIPAA guidelines. Everyone in the healthcare setting plays a role in protecting patient privacy. HIPAA mandates a variety of safeguards to protect patient information. This includes physical security measures, such as locked cabinets and secure access to facilities, as well as technical safeguards like encrypted digital records. Electronic systems must use passwords, encryption, and regular audits to ensure that only authorized personnel have access to patient data. In addition to secure technology, healthcare organizations also need clear policies on data sharing. Information can only be shared with patient consent or when required by law, such as in emergencies or for public health purposes. Let's consider a breach of confidentiality. Imagine a healthcare worker discussing a patient's health condition in a public space, like a hallway or elevator. Even if unintentional, this can violate HIPAA rules. What happens if HIPAA is violated? The consequences can be severe. Healthcare organizations and professionals can face hefty fines and, in extreme cases, criminal charges. In addition to legal penalties, a HIPAA violation can lead to a loss of patient trust, negative publicity, and damage to your career or business reputation. Here are a few best practices to help ensure compliance. Always verify a patient's identity before sharing information. Limit access to PHI based on a need-to-know basis. Use encrypted communication methods and stay up to date with HIPAA training. Lastly, remember that ongoing training is essential to ensure everyone in your practice is following the rules. A culture of confidentiality starts with you. To sum up, HIPAA is here to protect patient privacy and ensure the confidentiality of health information. As healthcare professionals, it's our responsibility to safeguard this trust and follow the law to ensure quality care for all patients.